Hello, everyone. Welcome. So thrilled to have you with us this evening for this very special Spark Your Health talk. So I'm sure we'll have some more guests joining us over the next few minutes, but we'll go ahead and get started here. We have a lot to get to this evening. So I am Katera Kapoor, and I have the privilege of being the Senior Director of Health Promotion, Wellness, and the Spark Your Health Talk series here at the 92nd Street Y. Thank you all again so much for being with us this evening. Spark Your Health is thrilled to be joined by Dr. Leslee Shaw and Dr. Angela Bianco, two esteemed leaders in women's health from the Mount Sinai Health System, for an in-depth discussion on cardiovascular health across the continuum of a woman's life, from childbearing to advanced age. Our format this evening will be a moderated discussion followed by 15 minutes of Q&A. So please feel free to be submitting your questions into the chat throughout the duration of the event. We hope you will join us for upcoming Spark Your Health events, such as The Joy You Make, a roadmap to finding silver linings with Stephen Petrau in conversation with me, coming up on November 13th. That should be a really interesting one, so I hope you'll consider joining us. And I would also, of course, like to thank our Spark Your Health Talk series sponsor, Mount Sinai Health System, for their generous support. And now, if we can go ahead and bring the doctors up on screen here, I would love to introduce both Dr. Shaw and Dr. Bianco. So, Dr. Leslee Shaw, we'll start with you. Dr. Shaw is a PhD leading outcomes researcher whose major focus is clinical diagnosis of cardiovascular disease. She is an endowed chair and tenured professor with appointments in obstetric, gynecology and reproductive science, population health, and cardiology. She is the director of the Blavatnik Family Institute for Women's Health Research and vice chair for research for the Department of Obstetrics, Gynecology, and Reproductive Science, and has thousands of publications and so much more on the horizon that I'm really excited to hear more about this evening. And we're also joined by Dr. Angela Bianco, who currently serves as the Director of Maternal Fetal Medicine for the Mount Sinai Health System and is the Maternal Fetal Medicine Fellowship Program Director. She has recently been appointed Assistant Editor of Expert Reviews and Clinical Opinions for the American Journal of Obstetrics and Gynecology. In addition to these roles, she has served as both the Director of Obstetrics as well as Labor and Delivery for the Mount Sinai Hospital. She led the obstetrics response team during the COVID-19 pandemic, at which New York City was the epicenter, and that must have been no easy task. So thank you both so much for being with us this evening. We really appreciate all that you do in this field, and I know you have some really critical information to get out to our audience this evening. So let's go ahead and start off the discussion. I'd like to start off by identifying the importance of understanding the lifespan of one's heart health. I'm not sure that everyone, I'd like to get us kind of all on the same page on what that means. As much as we stress the importance of being in the present moment, there are benefits to understanding the history and then the trajectory of our very own hearts that are letting us, breathe and be here right now. So can you each give a bit of background on the lifespan of heart health from your perspective? And Dr. Bianco, we'll start with you.
Oh, well, thank you. Thank you for that introduction, and I'm excited to spend some time with you and the audience. I'm looking forward to a really invigorating conversation. But I think you're touching on a extraordinarily important point, and that is looking at cardiovascular health as a continuum and not deferring attention to one's cardiovascular health until you are an older individual or an elderly individual. The more we focus on people's general sense of well-being and overall health from childhood through the entire spectrum of all the different changes that we go through, particularly as women, the better poised we are to be in as best a state of cardiovascular health as possible as we continue to age. And I think that it's really important for us as clinicians, as research scientists, physician scientists, to bring women's attention to their own health trajectory. And I guess I would add that traditionally there's been much more of a focus looking at men's cardiovascular health. And I'm happy to see over the last couple of years that the pendulum is swinging a bit and bringing more attention to female cardiovascular health.
Absolutely. Dr. Shaw, what do you have to add?
To add to that phenomenal answer. But I would chime in just a little bit and let you know that, really your history and each facet of your life is connected. It's linked. When you're 20, you think, oh, I don't have to worry about this, and oh, I can skip exercise. I don't have to focus in on my health until I get older, as Dr. Bianco said. But each stage of your life provides a keyhole to the future. And it is a link to the future, and things that happen to you when you're younger, or even in utero when you're in your mother's womb. There are many factors which will tell us what your life and your health is going to be. So we can find out when you're in your mother's womb, we can get an idea of what you're going to be like and the disorders you will have, particularly cardiovascular disease, when you're 60, 70, and older. And so if you think about your life as a continuum, everything is important. When you go to your doctor, everything is important. And so these will be factors that have a good communication, understand, be in tune with yourself, and understand that you have an opportunity, no matter where you are in your life, to make changes and to make positive changes, and to eat better, exercise more, relieve stress, and everything is important for your future health.
Absolutely. I feel like I'm already picking up on a theme here about, the earlier we do these healthy lifestyle habits and changes, and the earlier we can weave them into our lives, the better. So I'm already excited for where we're going to go in this conversation. So let's dive into where the problem areas are. From each of your areas of expertise, what are your concerns when it comes to women's heart health and the trends that you're seeing? And Dr. Shaw, I'd love to start with you.
I think so much, just to be frank with you, so much for so often, women's issues around cardiovascular disease have not been at the forefront of discussions in cardiovascular medicine in general. Often women have been attributed as not having cardiovascular disease. So when they went to seek care, had chest pain or other forms of high blood pressure, it did not receive the intensity of treatment similar to that of men. So a red flag is that you need to be aware that cardiovascular disease has historically been diminished in terms of a woman being at risk, but it's important for you to understand that and to be very proactive in creating a healthy cardiovascular health profile for you to enrich your life and to make strides for that. So you need to have an established relationship with a physician that understands that cardiovascular disease remains the leading cause of death of women, and that many factors are continuing to worsen in the United States. In about 25 years, about 2/3 of the audience here have high blood pressure, and about 2/3 will be obese. So we're not headed in a good direction. So it's really a critical time for everyone just to take charge of their life and make those changes today so that we can avert long-term, much more complicated disease patterns of cardiovascular disease than we see today.
Dr. Bianco, I'd love if you could chime in there. And also, you may have some perspective on problems that you're seeing from a pregnancy and postpartum perspective as well.
Yeah, well, I would agree with everything that Dr. Shaw just discussed. And I think it's really easy for a young woman or a young adolescent girl to really not think that it's important to address long-term health. And I think it is crucial for those that are acting as parents, teachers, mentors to try and engage young women, and also bring attention to some sort of clues that, as Dr. Shaw mentioned, might be a lens into future cardiovascular health. It's a little bit easier for people to really understand and grasp the concept of long-term health if we can focus their attention on things that they're actually experiencing at that specific point in their life. So if we look at girls that have early age at menarche, so they're young when they have their first period, some as young as 8 or 9 years old, or they have severe premenstrual symptoms, those things are linked to a greater risk many years later of cardiovascular disease. So we want to educate parents, teachers, mentors, girls to pay attention to that and know that they might be at greater risk later in their life, and that they should continue to try and modify risk factors that they have and try and optimize their health. We sort of sound like a broken record about exercise, diet, nutrition. But when you say, when someone says to you, hey, you actually have a risk factor right now that could increase your risk of having coronary artery disease, hypertension, heart attack, and you want to live a long, energetic, healthy life, right? You don't want to be incapacitated later in life, secondary to a cardiovascular event like a stroke or a heart attack. So whatever we can do to mitigate those risks along the way. And I can maybe a little bit later during our conversation talk about some of the things that occur during pregnancy that are also associated with potential cardiovascular events later in life, and why women should be focused on those sort of complications and how they might portend future health.
Yeah, one way to look at this is to say, okay, if I'm a young mother, I want to really understand my health and my risk right now so that I can teach my kids, my child, about what their health would look like. If you're a young mother, you can learn from your mother and your grandmother about what her risk was like at this. So each person that you are in connection with can provide you clues to put meaning into what it means to have a knowledge of your health and your risk at age 20, 30, 40, 50, and so on. And so I think that's the key, is to really understanding the connections, understanding that optimizing your health today can really benefit you in the long term.
Well, because it's such a theme right now, let's just jump right into those modifiable risk factors that you've both been talking about. Are there any that you would like to, really target and elaborate on a little bit more for our audience? Because I think we all would enjoy knowing practical ways, the cutting edge, trends that you're seeing, that we should be on top of for optimizing our heart health.
Well, I think that one thing that is crucially important is nutrition. First of all, I want to just admit that I don't think there's enough focus during one's medical professional career. I think nutrition should be a significant part of a curriculum for medical professionals. But I would say that if there's one thing that I would recommend that you do more than once in your life, is to set up a consultation with a nutritionist. And it's actually quite affordable, and oftentimes insurance will cover it. I've done it myself more than once. It's amazing how much you will learn from a consultation with a reputable nutritionist, and just learning about very easy, basic things that you can do in terms of changing your diet, avoiding processed foods, looking for things that are really enriched in terms of really high quality calories. And nutritionists have wonderful ideas about certain types of foods that are so accessible to us, but we're just not purchasing them. Very simple things that have really high protein content or fat content. And there's so much that we could do just by our nutrition alone. Eating processed foods and foods that are highly inflammatory are directly related to vascular health. So if there's one thing you can do that is, I would say, fairly easily modifiable, it's to pay attention to what you're eating and to meet with a certified nutritionist to go over a diet that's not only heart healthy, but healthy for your specific needs. And they will go over your medical history and your family history as well.
It's a great point, right? I mean, I think as a cardiovascular researcher, we always think about that Mediterranean diet, which is olive oil, fish, particularly unprocessed foods. But, I think that there's so much disinformation or challenging information. There's a glut of fads and trends in diet that in order to cut through it all, I mean, you need like a PhD in nutrition to cut through it all to understand. But if you can to take a shortcut to have a dietitian give you some advice, that's great. The other area that I think about is exercise. We live close to, well, we're here at the 92nd Street Y, and we are close to Central Park. I'm there every morning, so you can wave hi at me. But exercise is something that you can do, especially in New York. I don't have a car. I walk everywhere. But focusing on exercise as an important, and that's, some of the diet and exercise things also, as we think about starting young, it's much easier to have patterns in your life when you start than when you're 15. I can tell you, as a researcher who does research in people in their 60s and 70s, it's hard to change those patterns of diet and exercise when you're older. So think about these patterns earlier. Exercise is critically important. If you have not done it, I would again suggest, if you're in your 40s, 50s, or older, starting with an appointment with your physician to understand if you're healthy enough for exercise, or if you might need some more monitored setting. I'm sure there are programs, tons of programs at the Y. If you have heart disease already, there are programs that are monitored called cardiac rehabilitation that you can also use. Well, you'll feel more comfortable. There's a nurse in the room, and you can test yourself and push yourself a little bit more. There are all kinds of nuances to exercise in the heat, in the cold. And if you have an expert that can guide you as to what happens when it's 95 degrees, do I still go out at 1 o'clock in the afternoon? Probably not. I would suggest not. But I think there's still things that you can learn from having an appointment with your doctor before you start exercising, as well as getting some advice. Is there some form of a program that I could engage with locally that could help me, particularly starting exercise?
Fantastic. And Dr. Shaw, correct me if I'm wrong, but I believe you might be in the middle of some very interesting research around exercise and cardiovascular health. Can you give us some insights there?
Yeah, these are, we're in the prep of it, which is the fun part, to try to see if we can get it right. But this is for our exercise programs now are for obese individuals, people who are markedly overweight. I don't know if many people know that there are just a huge number of new novel drugs available for weight loss that are pretty effective at reducing weight. The challenge with these new drugs is they're not the only answer. As Dr. Bianco said, you have to eat well and you have to exercise. As you lose weight, your body is going to be lighter and you're going to feel better. And what you need exercise is, as you lose weight, to be able to do more things. Now I can walk up a flight of stairs. Now I can walk to the store and I can carry groceries back. So all of that needs to be couched into how you formulate an exercise program. What's the best exercise program? These new drugs, for example, you not only lose fat, which is a good thing, but you lose muscle mass, probably in equal amounts, which is not a good thing, because particularly women who are prone to being frail when they get older, if you lose weight and become more frail, that's not the great combination. The combination we want is for you to lose weight, become more functional, feel healthier as you're able to do more things and able to carry your grandchild or whatever it is, which allow you to be much more physically active within your life. That is the kind of research that we want to produce. So it includes strength training. It includes different types of strength training. As you know, there are light weights or there's heavier weights. What produces the kind of maintaining of your muscle mass while losing weight? And it also has tailored to protein intake, which is really fundamentally important for us to maintain a healthy muscle mass.
Mm-hmm. What do you both say to our friends in the audience who are maybe in their 40s and beyond, who maybe exercise hasn't been a part of their routine, or keeping an eye on their nutrition hasn't been the priority? Is it, I know it's never too late to start, but what are the benefits that you see and what are the changes that you see from a physiological perspective in your patients, in the research being done for individuals that start these healthy changes in their lifestyle at any age?
Well, I mean, some people honestly don't like to exercise. I hate to exercise, if I'm being honest, but I try and make it really simple. So, if I turn around, I have these weights in my office. I won't pick them up now for a visual effect, but I try and do whatever's easy for me. I also bought weights that I put around my wrist. So when I'm walking around at home or around my ankles, I'll walk back and forth, back and forth. If I'm watching CNN or some other show, at least I'm getting some activity in there. So I try and think of ways that I can make exercise a little bit less of a burden for myself and more enjoyable. So if you can incorporate those sort of things. Also, there are so many programs. I downloaded an app called Wall Pilates for menopausal women. I'm postmenopausal, and I can do Pilates using a chair and a wall in my apartment. Pretty simple, just following an instructor at my own level, right? And you improve with time. So it's absolutely never too late. And what we start to see when we do incorporate changes in nutrition, avoiding processed foods, eating lean, healthy protein, fats, and complex carbohydrates, we see improvement in vascular health. We see improvement in people's lipid profiles. People have higher energy, improved mood. The effects are really almost endless. And an individual, if they really start to make these changes, will see the effect themselves. And I would also venture to say that those that you spend your time with or maybe live with would also observe differences. There are really profound effects on just adopting better nutrition habits and some form of exercise on a regular basis.
And do we
Yeah.
find if we're going towards that cardiovascular disease state, can it kind of keep, making these changes? Can we help keep patients keep that heart disease at bay?
Well, we live in a Western country, and so heart disease is very prevalent. I would guess that a lot of people listening to us today will get some form of heart disease at some point in their life. That's not a failure of your lifestyle. You do have a genetic background, but there's so many effects of things that can be managed, things that can optimize your health. It may be drug therapy. It may be exercise. Exercise increases your good cholesterol, your HDL cholesterol. There are very few things that do that. And exercise, your arteries, when you want to do something, lift something up or walk, your arteries need to open. They need more blood into the muscle. And if you're not exercising, your arteries become stiff. It's like when you haven't exercised, you get up to walk around, you're a little stiff. But your arteries will become much more able to expand and contract as you have the needs of your body. That's physiology, cardiovascular physiology 101. But I think it's just important for people to realize that cardiovascular disease is prevalent. There's a lot you can do. There's a lot you can do for yourself: diet, exercise, stress reduction, things like that. There are drugs available. When I first started my career for like 10, 15 years, there were no new drugs in cardiovascular disease. Now we have a ton of them. And we not only have drugs, not only statins, because a lot of people don't like statins, they get muscle aches with them, but we have a lot of new drugs coming into the market. We have injectable forms of drugs that can be taken once or twice a month. All kinds of things which will really tailor to your lifestyle. And so augmenting what Dr. Bianco said, you just need to look at your life. You're not necessarily going to be that person that gets up at 5 a.m. and exercises for an hour, but maybe you can do 10 minutes 6 times during the day, walk around the block, take a break, And you'll get many of the same benefits you would of doing an hour of exercise around the reservoir 3 times in Central Park. So there are lots of things you can do. The big thing is to become knowledgeable, really engage in a great communication and discussions with your physician, and then know your history, know your family history, because that's a big clue as to whether or not you're going to have a risk of heart disease. And you may have a mom that lived, she was 96, never had heart disease, and that's awesome. But for many of us, we have a history of heart disease in our family. So understanding your risk and your family's risk is really a good place to start, and then beginning to think about how you can change your life.
So because you went ahead and said the word stress, I feel like I have to dive into that just a little bit. We know that exercise typically will lower our levels of stress and help us feel better. But so what are you both seeing in terms of the correlation between stress and heart health, right now today? Are we seeing complications stemming out of stressful lifestyles, and how does that impact the heart? And then what can we do about it?
Yeah, I mean,
I'll
go
let
ahead,
Leslie
Dr.
take this and I'll
No.
follow you.
Well, we live in New York. I mean, if you live in an apartment building, you've seen many, there's a lot of intense people in New York, a lot of stressed people. You've got to really think that your body is precious, right? And really adding a ton of stress. That's not to say that throughout a year, you won't have times when you have a deadline and it's stressful, but you can't have constant, continuous stress in your life. You can't be dominated by stress, and you can't be on the edge of being dominated by stress. You've got to think about interjecting things in your life to manage your life and make yourself healthy, but also just feeling more well-being about your surroundings and where you are. And honestly, if your job is super, super stressful, you really have to have a talk with yourself about whether it's worth it, and finding something else. Because what we see this pattern early on in somebody who's in their 40s, super high pressure, type A personality, really working hard, 80, 100 hours a week. And then at age, I'm speaking about a friend of mine, and at age 42, he's hypertensive, and then he doesn't eat well, so he has high cholesterol, and that's a pattern. And you start to gain weight, and there it goes. Stress impacts all facets of your life. And if there are times when you really can't control it, you need to take a step back and really have a talk with yourself about really making some changes to keep yourself healthy for yourself, but also for your friends and family around you.
Dr. Bianco,
one way to do that is try and remember the importance of enjoying small moments in your life. So I actually really relish my cup of coffee in the morning, and I actually drink my coffee very slowly, and I thoroughly enjoy it, and I look forward to it from the night before. And it's just little moments like that I think profoundly reduce my stress. And I also taught myself, like, I actually feel like my job is very stressful, and I'm seeing patients, and sometimes a high volume of patients. And I'll just say to myself, you're going to walk out of this building. It's all going to be fine. It's a little crazy right now, but you're going to get through it, and you're helping people. And I just try and focus and train my brain. And I read a quote by Warren Buffett the other day that said we should think of our bodies as our car, that we get one car that we're going to use for the rest of our lives. You're going to use it. You're going to park it overnight in your garage, and that's it. It's the only car you're going to get from the time you're a teenager until your death. And so you better take good care of it. And you can't change your DNA. We all know that. You can't change your genetics. But if you're doing some of the things we talk about, and unfortunately, you're somebody who ends up having a cardiovascular event, if your heart is in better shape and better condition, you're going to have a much better recovery and a long-term, really a better path to long-term recovery with almost return to baseline function. So you can't change your DNA for sure, But if you are somebody who has an event, you could set yourself up to be in a better position to overcome that event. So that's one thing. I also think that the surrounding yourself by people either in family, friends, or some other sort of social group, if you belong to any kind of a community or you have a hobby, surrounding yourself so that you're socially connected. I'm not saying that you have to be a social butterfly, but you have to have some connectedness. That's extremely important for well-being also, and important for cognitive health.
I love that car comparison. I'm sure there's
It's
some
Warren
friends.
Buffett, so I stole it.
I'm sure there are friends in the audience that that resonates with, but that's what it's all about, is finding, what resonates for you. And okay, if I look at it from this perspective, does it make you want to be a little bit better to your body? And Dr. Shaw, something that you said that I picked up on is, yes, the impact of exercise is cumulative. So to your point about, can you get 10 6-minute bouts of exercise in throughout the day, that really adds up. And it's the same thing if you were going to do a 60-minute in a row, maybe endurance wise, where, it's a little different, but the impact of exercise is cumulative. So to squeeze it in little bouts, I absolutely recommend, as an exercise professional in that field. So you mentioned at the very beginning that cardiovascular health in women is sometimes overlooked, and maybe it's not on the forefront of every physician's mind when they're meeting with a woman. So let's talk about red flags, symptoms. Are there things that women in our audience should be looking out for, or looking out for their granddaughters, for their children? When is it, when should our audience think about, okay, it's time to go to the doctor to talk, this is something that's not sitting well with me, or this is, a pain that I've had in my chest. Would love to hear more insight on that.
Well, I guess, can you just go back one slide? So traditionally, back to the menopause slide, I think it might be the second slide. So traditionally, we always, like, physicians would start talking about cardiovascular health when they're seeing people that are perimenopausal or menopausal, but we really are trying to shift that paradigm. Instead of using that traditional, and I would even say antiquated sort of philosophy of when to address these risks, we have to use an alternative paradigm, which passes through the entire lifespan. So we should always be looking at these risk factors, and how we can modify them, not just traditionally looking at menopause. And the funny thing, when I was a medical student, we were taught that when women have coronary symptoms, they actually present very differently than men. And they're going to tell you that they have back pain or shoulder pain. That's not really accurate or true, we now know. So women and men, even though their hormonal profiles are obviously different, they're still humans, right? And our bodies, for the most part, are largely similar. So oftentimes we do present in a similar fashion. But as Dr. Shaw said, because traditionally women are not thought to suffer from these sort of disease processes, it's dismissed and not addressed.
I think just to add to that is, one of the things I would recommend is everybody know your body. Know when you feel good in a day and know when you're off. Quite often you get these antecedent symptoms or feeling of malaise or fatigue that are part of the non-specific factors that go on, which makes diagnosis of heart disease difficult and challenging in general, but especially so in women. So understanding your body, what do you feel? I feel good today, right? But stop and take note of it, right? So when things are off, because so often I'll talk to a woman who had a sudden cardiac arrest, or had a heart attack, and they say, I just wasn't feeling right. That's not an uncommon thing for people to say. I hadn't been feeling well. These are things to listen to, right? Especially as you enter menopausal years and beyond, is really understanding. But the first thing you need to do, a red flag, is not wait to find a doctor until you have symptoms, because then you're going to call somebody's office you don't really know. You're feeling rushed. You don't have time to make to do homework on the physician. Your friend said, oh, just call this person. What you need to do is have an established relationship now while you're feeling great. Don't wait till you're not feeling great, because then it becomes very, very stressful. And find a physician that will listen to you, that has good communication skills, doesn't come into the room for 2 minutes and leaves. Find somebody who understands that heart disease is underdiagnosed in women. Find somebody who says, I know a lot about heart disease in women, and I'm happy to walk you through it. That's the type of person that you want caring for you, particularly if you're concerned or feel you're not feeling up to par. Those would be the best things I would tell. That's the big red flags. Be on top of your health today.
And is there anything for women specifically we should know about when it comes to referred pain? I know that, as someone may be going into some sort of cardiac event, there may be something like jaw pain. It's not always just the traditional pain in the chest one may think of when you think of the heart. So could you give us a little bit of, I know it's different for every individual, but maybe for our women in the audience, there are things that they could be on the lookout for.
I think the biggest kind of thing that happens, particularly, is if you're feeling symptomatic and you may not even really be totally cognizant of thinking of it, you have a tendency to accommodate your physical work. If I feel short of breath when I walk up the stairs, I try not to walk up the stairs. Those are signs. If at age 50 or 55, you can't do the things you could, they may be flags. And so understanding what is the difference. So, and shortness of breath is one that you just think, well, I'm out of shape. Well, it might not be necessarily. It's a sign that your heart is not keeping up with the physical work. So you could have jaw pain, right? You could have arm pain. All of our pain receptors are not so fine-tuned in our chest like they are in our fingers, right? And so you could have different symptoms. It could be, in your husband or a partner or whoever may have different symptoms. Understanding that may be your norm and that may be how you present. And really, again, accommodating symptoms is a classic thing that I see women do. I'm not going to go, for that extra walk because I'm just going to take the dogs for a shorter walk because I get short of breath, things like that. And then when you go to the doctor and they say, have you been feeling okay? Yeah, I've been fine. Mm-hmm. Yeah, I haven't felt anything. Well, that's not really true because you basically now not doing anything but sitting on the sofa. So, you really have to understand, and really think through and understand the differences and knowing how your body responds.
Dr. Bianco, anything to add there?
Well, I think that Dr. Shaw highlighted a really important point, and that is to engage in ongoing care, whether that's an internist or a cardiologist. Probably most people would start off with an internist, but somebody that you have an ongoing relationship with, that knows you, that you feel comfortable with, that will be able to address even subtle changes if you bring them forth conversationally when you go in for your visit. Somebody who knows you, has your history, has a track record of your state of health is extremely, extremely important. And I also think that Dr. Shaw's touching on, how women traditionally also are caregivers, most of us, and we do tend to minimize our own symptoms and sometimes even our own health needs. So paying attention to yourself, like they say when you're flying, you need to put your oxygen mask on first, right? So don't dismiss or minimize your own symptoms. Make sure that you prioritize your health and advocate for yourself and your health.
Okay, so it sounds like no specific symptoms we're on the lookout for. It's more just knowing our own bodies and if, there's that kind of recurring pain. Because somebody, getting pain in, say, their shoulder over and over may think to go to a physical therapist first.
It's
right?
very common.
And then that physical therapist is hopefully trained in understanding when the pain does not get better, they need to be referred onward.
Yeah, and that's where I think having an established relationship
Yes.
is so critical and fundamental to your health. You know, I think one of the things that we've just recently announced, and Dr. Bianco and myself and others at Mount Sinai are going to be a critical part of this, is a new comprehensive care center called the Rowan Center, which will really be able, will be a one-stop shop. I hate that word, but a one-stop shop for women and all their needs. And that's really, I think, the trend in where future healthcare is going for women, is not bouncing around to an endocrinologist or this or that. You know, I need one place to go and get all my care. And that way, all of these great doctors can be in the room and talk about me and make me the healthiest I can be. And I look forward to getting to the point where we open those doors.
That sounds like it will be a wonderful resource for everyone in the area, and they're starting to pop up, thankfully, around the country. So even if you're not right here in New York City, hopefully you can find something like that. So I want to start, we're starting to get close to Q&A time. I want to start delving into when the heart is overloaded. So pregnancy will certainly be a part of that, but I also wanted to touch on hydration. And you can both correct me if I'm wrong, but I have heard that when we are dehydrated, the heart has to work harder. So can you speak to that a little bit? And, I'd just love if our audience, if you have any recommendations for our audience on hydration and how that ties into heart health over the lifespan.
If anybody here is an exerciser outside, I mean, some people like to exercise inside. I don't know why. If you exercise in the summertime and you monitor your heart rate, anybody would know if they've done more than a half an hour, and you do your exercise right now, maybe September, October versus July or August, the heart rate is different. And so it is the heat and the being dehydrated will augment your heart rate response, will increase it. So staying hydrated is fundamental, not just to having, not just to increasing too much stress in your heart, but it's fundamental for recovery. You need to be well hydrated for all your muscles and for your heart to recover after an exercise bout. And so you have to be careful in hotter temperatures, or if you fly a lot, you have to be careful of dehydration, and you have to be cognizant of making sure water is an everyday part of your life that you are purposeful with. So, I mean, that's just really fundamentally important.
Got it. Dr. Bianco, did you have anything?
I was just going to say, and it's such an important and easy thing to do, and yet often overlooked. And you just have to carry around that water and make sure that you get it in. A lot of people now are using these wearable devices, rings, watches. And if you track, which I'm sure many people in the audience are doing, if you track your profile, your data, you'll see if, let's say you have a few drinks or a salty meal, you go to sleep, your baseline resting heart rate will increase over time throughout the evening and perhaps during the day because you're relatively dehydrated. And so, some people might say, oh, that's counterintuitive. I thought you wanted to work your heart. That's why you exercise. You want to get your heart rate up. Yes, but not continuously 24 hours a day, 7 days a week. We don't want to overly stress the heart. So there's sort of a sweet spot there. But it's, if you really start to use some of the wearable devices, they're very, very insightful in terms of your own, body's metabolic profile.
Got it. Okay, so stay hydrated and lower the stress in your environment to kind of keep that low grade stress away from the heart, is what I'm hearing. Okay. All right. So Dr. Bianco, if we could, I would love to talk about pregnancy and postpartum. And, for our women out there that have gone through this or are going through it, is one more likely to develop a cardiovascular issue or event from a pregnancy, or is this, kind of just peeling back the curtain on something that was perhaps already existing from the very start that the woman maybe just didn't know?
I would say it's probably somewhere in the middle, but I think traditionally we look at risk factors for cardiovascular events like abnormal lipids or elevated cholesterol, obesity, high blood pressure, perhaps diabetes. But women, in some ways, are fortunate because they can identify risk factors through the lens of pregnancy that are just as robust in terms of predicting long-term cardiovascular health. So when we look at pregnancy, there's a slide that was just put up. There are lots of conditions that can arise during pregnancy that perhaps somebody has an underlying disposition to cardiovascular disease because of the vascular health, the lining of their small vessels. And it's uncovered from the extra burden of pregnancy, from an increase in your blood volume and your heart having to pump to essentially provide nutrition to the placenta and the fetus. So the things that we see that can occur during pregnancy include things from early pregnancy through late pregnancy, such as pregnancy loss, recurrent pregnancy loss, stillbirth, high blood pressure that develops or is exacerbated during pregnancy, diabetes, poor fetal growth. All of these, there's now a plethora of data and research that has been published that demonstrates that all of these disorders that arise during pregnancy are associated with increased long-term cardiovascular events, including chronic hypertension, coronary artery disease, or heart attack. So if we are educating women and their families about the risks associated with these disorders, we're in a better position to engage them in ongoing care, like Dr. Shaw was talking about, so that they can regularly have their blood pressure and their lipids assessed, and also maybe meet with a nutritionist and perhaps either a physical therapist or some sort of an exercise program, because these are risk factors that we need to pay attention to as much as we pay attention to traditional risk factors in males.
Excellent. Excellent. Dr. Shaw, anything to add there?
No, I just think it's important for us to really take note of what goes on during pregnancy. Some people like to call it a stress test for later years. I'm not sure how well I like that term, but certainly if it affects you, it's going to affect your children. If somebody has hypertension during pregnancy, their offspring, about 1 in 8, will be hypertensive before the age of 30. That's incredible. So there's a piece of information that is very necessary for you to manage your hypertension and to keep control of it, and really have a better pulse on your kids to make sure that they can live a healthy life. Managing blood pressure is hard because we live in a Western society where salt is everywhere, but really there's an opportunity there for you to make changes in your diet. Exercise will help with lowering your blood pressure. Obviously, there are many, many drugs that can help with that. And it really isn't important because you're still young when you're pregnant, and your kids, you can keep an eye on them through those early years.
Well, my hope is even just by hosting a talk like this, we're helping build an awareness between the correlation between an event like pregnancy and, oh, I should advocate, with my physician for maybe some additional testing, or like you said, just noticing if something is a little off. Because isn't it true that also some of these heart issues can develop a little bit later on? It could be years after the pregnancy. Is that right?
Absolutely. Yeah. No, absolutely. Go ahead, Angela. Sorry.
No, I was going to say the same. We agree all the time. No, I mean, I think it's really important, especially for women that develop a severe hypertensive disorder during pregnancy, that they have close cardiology follow-up in the postpartum period. And I would even advocate for an echocardiogram, so an ultrasound to look at the function of the heart. And absolutely, if you're going to do this, you want to be engaged with a physician that understands these risk factors and the importance of surveillance. And again, will not minimize your request to have these procedures performed or dismiss any concerns or symptoms, because there are women that develop longstanding cardiac dysfunction that probably could have been diagnosed earlier in the course. And it's largely because this just wasn't sort of assessed with the appropriate tools. So advocating for yourself and being aware of these risk factors, because an echocardiogram, frankly, is not that difficult to order or to find a really skillful cardiologist to perform. And you might have to have that done serially, even annually, but that's okay and helpful. And you'll be able to pick up changes earlier in the course.
What's fundamental to what Dr. Bianco said, and this is where it's critical, is unmanaged hypertension does not go away. Uncontrolled hypertension leads to heart failure, which is what Dr. Bianco is talking about. So if you have high blood pressure during pregnancy, you've got to keep track of it. You've got to understand how your heart is adapting. There will be what we call maladaptations that will go along, that the heart will become dysfunctional with uncontrolled hypertension. And you don't want that to happen. And you can manage that. And guess what? A lot of it is reversible with effective medications. That's the key, right? And so that is where it's really important to stay on top of your blood pressure, particularly because you don't walk around and you get up in the morning and you flip a sign and says, oh, I have high blood pressure today. That's why they call it the silent problem, because you just have to actually buy a cuff, keep it at home, and press the button and see what it is in the morning and at night.
Yeah, I mean, I just want to repeat what you just said, that uncontrolled hypertension does not go away. That is just a huge statement. And I think that is something that everyone should have at the forefront of their minds of this is, why those modifiable risk factors are so important. But then again, at any stage that you can jump in and start working with those interventions to help yourself live as long as possible. So I want to pivot a little bit and gradually bring us into Q&A. This is such a good conversation. It's almost been hard to do that. But pivoting from pregnancy and postpartum to menopause, I think we have some questions coming in on what are the impacts on cardiovascular health when going through menopause? What do we need to be on the lookout for? And are we at higher risk when going through menopause of a cardiovascular event, cardiovascular disease? Can you elaborate on that a bit? I'll open the floor to both of you.
I don't like to use the phrase we're at higher risk, because again, I think it's looking at it in an antiquated way. It's a continuum. So we're aging. When we go through menopause, we're older and we're aging. Every day we're all aging. So the more we age and the more our vascular tree ages, there's more abnormality in the ability, the vessels are stiffer, and yes, we're more likely to have some of these downstream issues with our hearts or high blood pressure. And if you're engaged in care and you pay attention to your daily routine and any symptoms that you might be feeling and you report them, you're much more likely not only to live a long life, as you mentioned, but to be able to live a long and robust life. Because I don't want to live a life where I'm, really incapacitated. I want to remain vigorous for as long as I can. And so I think doing everything that we talked about through menopause and beyond is important. And another thing that I think I mentioned it earlier, but there's also recent data looking at things like vascular dementia and how having hypertensive disorders in pregnancy strongly predict vascular dementia. And that's because exactly what Dr. Shaw said, because mostly the underlying common thread is blood pressure and poorly controlled blood pressure. So we want to really pay attention to that and be engaged in care and be really in tune with our own bodies.
You know, you lose estrogen as you enter menopause, right? It's a gradual loss of estrogen, which is the hallmark of menopause. And once you have not had your period for a year, you're considered postmenopausal. And what happens as you lose estrogen, your blood pressure goes up a little bit, not like it doesn't jump up to be a 200 over whatever, but you're going to see a trend in up. Part of that is what, as Dr. Bianco talks about, it's the vascular stiffness you get as you age with your blood vessels. They aren't as pliable as they used to be. Your lipids will change. That's probably the most noteworthy. You'll get a decline in the good cholesterol, the HDL cholesterol, your LDL cholesterol, and I noticed it too. I'm gonna say I was pretty upset about it. But these are things that are going to happen, and understanding them, and then again reinvigorating your life towards what you can do. Remember, we said exercise could lower your LDL cholesterol, and exercise can help maintain your blood pressure. So remember that you live about a third of your life post-menopause. So it's not a death sentence. It's not a death knell. It's something to say, okay, now I'm going to make the most of it because I still have a lot of things I want to do. And that's how you have to look at it and understand that menopausal transition is really somewhere around a 10-year phase. It can be shorter or longer. Everybody's different. But there are some physiologic changes. Your risk of heart disease increases with your age. It's a fact of life. And women's heart disease risk lags about 10 years behind that of a man. But menopause is the key transition point where our heart disease risk increase. It's not like this. It doesn't go from the first floor to the 80th floor all at once. It's a gradual risk. So there's plenty of opportunity, plenty of time to really engage in your lifestyle, to really delay that as much as possible, if not forever.
Absolutely.
And I just want to add, Dr. Shaw mentioned the decline in estrogen, and I also would urge women to make sure that they are being seen by their gynecologist and that they discuss hormone replacement therapy. For years ago, there was some data that was published and widely disseminated that suggested that hormone replacement therapy was associated with increased cardiovascular risk. And that way of thinking has really kind of been turned around 360 degrees. And the recent data doesn't really support that and suggests that hormone replacement therapy, especially transdermal forms of estrogen, are associated with improved cardiovascular health. So I think that, anybody who's listening to this that's going through menopause, you should have a conversation with your gynecologist to see if you are a candidate, and make sure that you are seeing somebody that's really knowledgeable about the current literature and data that's available.
All right, so we're going to shift over to a question. I know we're about to wind down now, but the question is, if we do have heart disease in our family history, at what age should we start seeing a cardiologist for testing? And I would also flip that question to say also, if you don't have heart disease in your family. So I think we want to know the ages for, the ages for both.
Sometime around in your teens and early 20s, somewhere in there, you need to have like a cardiovascular risk profile assessment, blood pressure, lipids, blood sugar, glucose, to understand if anything is present in that. That would be like a ground zero. That doesn't mean you have to see a cardiologist, but certainly if there is a significant family history, particularly I'm just going to make one generic threshold because there's controversial and depending, certainly if you have somebody in your family who had a heart attack before the age of 30, 40, or 50, you likely need to have a discussion you should have a discussion with your internist, your primary care physician, about getting more of a workup with the cardiologist. And so, it's not uncommon at all. We have a lot of very dedicated family history preventive cardiologists at Sinai that take great care of people. And certainly if you have a history, not necessarily a history of somebody in your family who had heart disease at 70 or 80, because then it becomes a more disease of older people, but it's particularly when it's early on in life. And then certainly you want those lipid assessments, you want that blood pressure. I said, if a mom had hypertension during pregnancy, she's more likely to have a child who's going to have early hypertension. The same can happen with familial hypercholesterolemia or high cholesterol that has a family history, has a genetic predisposition. So all of those things should, somewhere around teenage age years, really start to get an idea of your risk profile, but certainly very aggressively go see your internist and get a referral to cardiology if you had somebody who had sudden death, age 35, 40, et cetera. Anything younger is a big red flag. Maybe Dr. Bianco can also chime in.
No, I think that you said it. Well, I guess I would say for any potential parents that are listening to this, that I would even speak to your pediatricians about getting a lipid profile on your child, which many of the pediatric practices now do, especially if there is a familial condition of hypercholesterolemia, because that's something that you want to know about early on in childhood and really be proactive about managing that.
Absolutely. I'm taking note of that for my little ones at home. All right, we are past time, but I just have one very quick rapid fire question I'll ask you, which is just if there are any supplements out there that you recommend, because we did have a few audience questions about that for managing heart health risk, and then we'll end it there.
Oh my God, that's a rapid fire one.
We can always put it in the post-event communication too, if that's easier.
Dr. Bianco, do you want, I mean, the only thing I would say is, certainly a generic, well-rounded vitamin supplement might be helpful. Certainly understanding your vitamin D level in New York City, where so much of the wintertime we don't get much sunlight. That would be a good one to think about. These are very common ones. Maybe some fiber supplements might be helpful. I'm giving you just what I do, so maybe Dr. Bianco can tell you.
Well, I carry around a magnetic box that's filled with supplements, so I agree. I mean, so I take vitamin D every day for bone health, a calcium supplement for bone health. I take magnesium for bone and cardiovascular health. I take fish oil every day in an oil form, not an encapsulated form. I can give you the information on a really reputable company that doesn't taste like fish oil. I actually do not really like to eat fish, which is why I take the fish oil. I also take CoQ10, which is a pretty powerful antioxidant. And also for cardiovascular health, I have a strong family history. So, vitamin D, calcium, fish oil, CoQ10, magnesium. And the other thing that if there was one thing only that I could take, it would be turmeric. And I take a turmeric supplement every day as well. The best form of turmeric is to just eat a turmeric root, but who has time to find turmeric root and who has time to, it tastes awful. It's very bitter. I buy it sometimes and then it just gets rotten in my refrigerator. So I just take the turmeric supplements.
Well, thank you so much for that. And maybe we will take you up on that. I can put that in the post-event communication with our audience if you do have a reputable brand. So with that, I would like to thank Dr. Bianco and Dr. Shaw so much for being with us this evening. I feel like we could have had another hour to cover all of this amazing information, really life-saving information, and also bringing it back to the basics in some way, that these things that we talk about, these modifiable risk factors, behaviors, exercise, hydrating, and having community, being in touch with your physician on a regular basis. These are all things that we can bring back to our communities, our friends, and our loved ones, and just help them stay on top of their heart health, not just for now and not for 20 years from now, but for their entire lifespan. So thank you so much for taking the time with us this evening, and thanks for all that you do. And I hope that everyone out there in the audience stays very well.